a lot of different reasons why you should keep your wisdom teeth, and also maybe a similar amount of reasons why your wisdom teeth should be removed. Now, wisdom teeth at dentists are called third molars. So wisdom teeth are the same as third molars. So if you hear the term third molar, those are interchangeable. So there's a couple of reasons that immediately ring true to me. Number one, if you have a wisdom tooth that's coming through the gum tissue and it's just stuck and it's not going to move anymore, then it can cause some type of gum infection in that area. You may have even had this type of scenario where you could bite on your gums, or there's food that can get in there. You just barely see your tooth peeking through the gums, almost like when you're teething. It's like when you're a toddler, or if you have children, you can see that just peeking through the gums, but it never quite comes out. It can create an environment where you can have a gum infection, and we call that an operculum, and it can be difficult to clean, and that's really a major issue. You can have a lot of pain and a pretty good infection there. And that's really the reasons in general why we should remove these. If they're going to interfere more than they're going to help. So think about it like that. Is your wisdom teeth or your third molars going to interfere more than they're helping? If all four of your wisdom teeth or your third molars have popped through and they're in perfect occlusion with one another, then great. If you're cleaning them well, if you're able to floss all the way back there, if you're brushing them well, no problem. If they're tilted or they're coming in crooked, all they're gonna do is cause a potential risk for certain bacteria accumulation. You're going to end up with a problem with not only periodontal issues, which is the gum and the bone issue, but also the plaque and bacteria that cause tooth decay. So to avoid tooth decay, not only on the wisdom teeth, but also on what I call the important teeth, the teeth in front of the wisdom teeth, the second molars and beyond, but mostly the second molars. I've seen so many cases of patients that have not gotten their wisdom teeth removed when the wisdom teeth was kind of crooked and crowded toward that second molar, and there was a cavity that formed on the second molar. So now you've got issues with the second molar that we really want to keep. We want to keep them and keep those healthy, whereas the third molars can be sacrificed. So pay attention to that as you're a teenager and up. You're mid to late teens. You're going to want to have a determination by your dentist if your wisdom teeth will be able to come into the mouth. And if they're not able to, then probably around the late teens, early 20s, that's a good opportunity for them to be removed. Unless, of course, it's been determined prior to that it's just not going to work out. There are cases where you have these retained teeth that are not going to erupt, that are inside of the bone, where you end up having a cyst that forms around too. So if you have a wisdom tooth that isn't erupting and it has to be constantly monitored by the dentist, there's also an issue with that as well, because it could present, although rare, a issue down the road where some type of cyst can form, and then you end up with a bigger jaw problem. Other than that, we try to blame wisdom teeth on all kinds of things, pushing the teeth in the wrong dimension and all of that. It's less of that than keeping a healthy mouth and a healthy bite. So, of course, we encourage you to come in for a consultation and discuss with your dentist at Concierge Dental Group whether or not it's a good idea for you to have those wisdom teeth removed. And we can do that for you as well in our offices. But mostly and most importantly, make sure you keep everything really clean if you want to keep those wisdom teeth, those third molars in the back.